I'm going to be your student nurse today. I'm just going to do hand hygiene and provide for privacy. Can you name your date of birth? Perfect. And do you have any allergies? Okay, and on the side note of allergies, have you ever had any reaction to iodine or latex before? Okay, perfect. So just looking at the provider's orders, it looks like we're going to be inserting a catheter today. Have you ever had any difficulties with catheters in the past? No, perfect. Are you able to bend your legs okay? Okay, and you already gave me your name and date of birth, but could you tell me where you are right now? And do you know where what you're doing here? Perfect, and do you know what the date is today? Perfect. Alrighty. Also, before we get started, for the insertion of the catheter, did you want any pain medication at all? No, perfect. So if I did that, I would do that about 30 minutes prior to the procedure. Alrighty, so now that we've gotten that all started up just a little bit, I'm just going to do a really quick abdominal assessment before inserting the catheter. So I would have my stethoscope and I would clean it off with alcohol wipes before the procedure. So I'm just gonna uncover you here. And first I'm going to inspect. So I'm just gonna inspect the abdomen, see if there's any striae, any abnormalities, any bulges, masses, if I can see any physical bladder distension, any thing abnormal, which I don't. So now I will auscultate. So I'm just gonna auscultate all 4 quadrants, starting in the right lower quadrant, listening for bowel sounds. And I'm also gonna listen to the arteries, so the aortic, using the bell. So the aortic, renal, iliac, and then I'd also do femoral. I would clean that off after I'm done using it, and now I'm going to palpate. So I'm going to palpate starting in the right lower quadrant, feeling for anything abnormal, and I'm also going to palpate the bladder for any distension. Have you gone to the bathroom recently? Yes, you have. Perfect. And you've urinated? Perfect. Okay, now that I've done that, I'm going to start out the procedure. So I'm just going to grab a pair of gloves. As before inserting the catheter, we are going to want to clean the perineal area. And at this time, I'm also going to identify where the urinary meatus is. Okay. So the urinary meatus is above vagina, but below the clitoris. So using a lukewarm soapy towel, I would clean far away, changing spots, closest, changing spots, and in the middle. Then I would discard and I do the same thing but drying. And I would take off my gloves and I would wash my hands with soap and water for 20 seconds, as now we are going to be doing the catheter insertion. Do you have any questions or concerns before we get started? Are you sure you don't want any pain medication? Okay, perfect. So now that we've done that, I'm just gonna remove my stuff here. And I do like alcohol swabs instead of iodine, as the patient is allergic to iodine. I would first check to make sure that the catheter wasn't expired, like the catheter kit wasn't expired, as it is sterile. And it looks like we are going to be inserting the balloon with 5 cc's. And it's 12 French, which is the right size for our patient. Okay. Now to start out, I'm just going to start by opening up the catheter kit. Making sure to only touch that 1-inch border. now I'm going to take out this sheet, touching only the 1-inch border. And I'm going to make sure the shiny side goes down. Okay. Now that I've done that, now I'm going to put on my sterile gloves before I touch anything else. I'd also make sure to have trash right next to me. And these are latex-free gloves, so if the client was allergic to latex, these would be good. Okay, just take that off. Now I'm able to touch inside the kit. So we don't need these sterile gloves. We don't need this cover as it's a female, not a male. We don't need the iodine because he's allergic. This would be used to collect a sample, but we don't need it. So now I'm just going to set up the catheter kit itself. Okay, this would be trash. This would be trash, but I'm just going to put it over here so I don't lose it. Now I'm going to attach the syringe to the catheter. This would be trash as well. I'm just going to put this catheter inside the lubricant. We're just going to say that's in. Okay, so after I put it in the lubricant, I'm going to move my workspace to over here. I'm going to have my one hand be sacrificed, and I would have a partner holding my alcohol swabs, and I would just do it the same way I did earlier. I would do farthest, closest, and middle. Alright, now that I've gotten that, I would take the urinary catheter out of the lubricant, and I'm going to insert it. Take a deep breath in as we insert it. As soon as I see urine, I'm going to insert the 5 cc's per the provider's orders. Okay, I'm going to take this off. I would throw that away. I'm just going to tug, making sure it's in properly, which it is. So now I'm going to take the urinary or the bag out. I would attach it to their leg and attach it to the side of the bed, but just so I can show, if I was getting a sample, I would take it from this port right here, as this is sterile and urine from the bag is not sterile. Okay, so then after this procedure, I would clean everything up. I would cover the patient back up. I would take off my sterile gloves appropriately. I would wash my hands, do the 5 checks, making sure the bed was low and locked, side rails were in place, client has their call lights, and no risk of falls. And I would come back and check on them in a little bit just to make sure they're still doing okay. and I would document if there were any abnormalities, and I would document the procedure itself along with how much CCs I would have put in. And after I clean up and leave the room, is there anything else I can do for you? No? Perfect. So like I said, my gloves will already be off, and that would be the end of the procedure.